Hi, I'm Lauren,
And I'm Micah.
and today we're here to share with you how we found Global Health lives locally here in Anchorage. Before we begin to share about the wonderful people that we got to know through this project, we want to go over a few key definitions. So, global health, as defined by our text from Jacobson, is transnational health concerns across national borders. Along with global health then comes health transitions, especially for immigrants, and health transitions are defined as the shift of health concerns in the United States. So many immigrants do face a lot of the same health issues that we as Americans do, but oftentimes it can be more difficult for them due to finances and language barriers. So the first person that I got to interview was a girl by the name of Sophie, who I met through one of my classes here at UAA. Sophie is originally from Oslo, Norway, and is 23 years old and is in the process of completing her bachelor's in outdoor recreation. So Sophie did feel that there were some very similar health issues from Norway to America, but the rate of obesity was one that definitely stuck out as much higher in America as compared to Norway. So I did a little extra research and found that Norway's obesity rate is 8.3%, while America's is 30.6%. So here's a quick video of Sophie just talking about these main differences. And we were talking a little bit about diet differences. Is obesity a big issue that you guys deal with in Norway?
It is a big problem as anywhere else in the world, but not as many obesity individuals as in the United States in percent. We don't have as many junk food stores, and it's not that expensive to buy healthy food in Norway, even though in general Norway is more expensive than the US.
Mm-hmm. So as Sophie said, the accessibility to junk food is not nearly as convenient in Norway as it is here in America. A typical Norwegian diet consists of fish, potatoes, and meat and vegetables, while an American diet is refined grains, added sugars, fats, meats, and sodas. So the next person that we got to interview, both Micah and I interviewed together at the Alaska Literacy Program. The lady that we got to meet with was named Cecilia, and she's originally from Korea. She moved here about 2 years ago with her husband and 2 children. Since moving here, her daughter has developed over 14 cavities, and when they went to the dentist, they found that it was going to be nearly $5,000 to fix all of her cavities, and their insurance here in America would only cover $1,000 of that. So because of that, they decided to go back to Korea for her dental care, and even with the cost of plane tickets, they still will end up saving money because in Korea they have free healthcare for those under 12 years old, so all of her dental care will be provided.
So I also interviewed Cecilia and got to know more about Korea's healthcare system. They had free vaccinations for babies, free healthcare for those under the age of 12 and over the age of 60. And their healthcare also included an annual physical every 2 years and ER care when needed. All individuals end up paying on a sliding scale according to their income. And according to Cecilia, she felt that the healthcare quality was equivalent to here in America. So the person that I personally interviewed was Cheyenne Williams, and she is a UA student who moved here from the Caribbean. She grew up on the island of Dominica, and her father was a police officer there for 20 years, and her mother was a legal secretary. Recently in March, her and her father and her youngest sister moved to Alaska to be with her eldest sister and attend UAA and experience some of the things that America had to offer. So the healthcare system in the Caribbean is kind of similar to that of Korea. They do have universal healthcare on some of the islands of the Caribbean. However, her particular island does not have free healthcare. Um, the universal healthcare systems that are available throughout the Caribbean also provide free healthcare to children under the age of 12 and elderly people over the age of 60. However, unfortunately, most surgeries must be paid for by the individual's family, and physicals and procedures tend to be very expensive. She also noted that unfortunately there is a low quality of healthcare there, and often the supplies and medicines that are needed are not available to the patients or are currently broken down and in need of repair. They do pay similarly as Koreans do for their sales tax. However, it's called a value added tax system, and they pay about 12%. So the healthcare concerns in the Caribbean were similar to that of America. However, she noted that there was less obesity and less chronic healthcare concerns. She felt because of the higher levels of exercise and diets comprised more of fruits, fresh veggies, and fish. She also noted that many people in the Caribbean own their own, well, hold their own gardens, and so fresh food is readily available.
So throughout this project, we definitely learned a lot. Some of the main things we learned was that government-funded healthcare systems provide basically full coverage for children under the age of 12 and then over the age of 60.
There were similarities between the Caribbean healthcare systems and the Korean healthcare system, such as providing healthcare to babies, children, and the elderly.
We also found that adjusting to a new culture tends to be easier for younger people, especially someone who's a student, such as Sophie and Cheyenne. When we talked to Cecilia, she found it hard to make new friends and kind of find a place to get social interaction with people her age.
Also, the quality of healthcare differs between each country's system. As I noted, the healthcare in Korea was perceived to be of a higher quality than that in the Caribbean due to the lack of supplies and medicines available in the Caribbean.
We also learned that it can be difficult for immigrants to know where to access healthcare here in a new environment. And like we had talked about, Cecilia didn't really realize that she could go to a doctor's office instead of going to the ER for every health concern. So we hope you enjoyed our project, and thanks for listening.
Thanks.